Hello, Bundibujo Uganda team. It's nice to be back with you again. We just completed a week-long celebration of what we call Thanksgiving here in the United States, where we get together with our families and thank the Lord for the blessings that we've received. We have a traditional feast, which is turkey, and I was fortunate enough to have all four of my children with me, which was really very nice. And so now we're back together. I would consider you part of my family as well, and I'm thankful to be back together with you on this video. Um, you can see by looking outside that it's gotten colder here. Temperature oftentimes runs about 7 degrees centigrade during the day, and it drops down as low as -3 at night. So you can see I've got my sweatshirt on because it's getting cooler. So I wish I was in a warm spot like you guys are. So I'd like to talk a little bit about a case which was referred to us, a 13-year-old young lady who is having difficulty with walking and weakness in her lower extremities. And so I'd like to discuss that case a little bit and review it with you. Now, the chart note for this patient shows that she is 13 years old, that she complains of difficulty with walking and strength in her lower extremities, and it seems to be intermittent. It's not present all the time. She is recorded as having some intermittent abdominal pain as well. The history suggests that it's been a problem for 7 months. She is reported as being alert, calm, and awake, and not to have any difficulty with her speech or vision or hearing, and no loss of bowel control. Now, I got a note from Steve, and he said that the patient couldn't talk or had trouble with talking. I think he meant couldn't walk. I think that was a typographic error. And so I'm going to go with the history that's recorded in the EMR 4DW chart. And I'd like to make a couple of observations. The muscle strength was recorded as 5 out of 5 in the lower extremities, which would be normal muscle strength apparently at that exam. And so that was a good observation, that there was a good recording of the muscle strength. Now, in the exam, there wasn't a record of any reflexes or any record of sensation, and those would be important factors to know about. And I would encourage you, when you're examining a patient with neurologic symptoms, to check for reflexes and check for sensation as well as for muscle strength, because we're trying to figure out whether or not the problem is up in the brain, or if the problem is down more peripheral in the spinal cord or further down in the peripheral nerves. And those that information of reflexes and sensation can help in determining that. Now, I've taken a screenshot of a picture out of osmosis video on muscle weakness. Now, it's a very long video, and I would say it might be worth looking at, but I would look at only the first 5 or 6 minutes of it. You can surely listen to the whole thing if you'd like. It's quite complete, but the first 5 or 6 minutes kind of help you understand the difference of what things you should be looking for in the exam. And so let's look at that screenshot now. So I want you to look closely at the upper and lower parts there on the left-hand side of the picture. And so upper would refer to a problem that was occurring in the brain. Lower would be a problem that has occurred from the spinal cord down. And you can see the difference. If it's an upper problem like a stroke, they're going to have high muscle tone, normal muscle bulk, and hyper-reflective reflexes. If it's a problem in the spinal cord or further down, like in this patient might have been tuberculosis or something like that, the muscle tone is going to be decreased, the muscle bulk is going to be atrophied or small, and the reflexes will be hypoactive or absent. So you get a flavor of why it's important to add testing for reflexes, and also getting an idea of muscle tone and bulk is important. Now, another thing I wanted to talk about was in the exam, it says that strength is 5 out of 5, which is normal, but it records a power gait. And I think that that is a misspelled word. I think that what was meant to be said was a poor gait. And if I'm right, then I think it would be nice to have a description of what you're seeing in the gait. And so I'd like to have you look at a video that's done by Stanford University here, a very prestigious medical school. And it's in a series called the Stanford 25, and it's available to anybody. You can search for it on Google, and what it would be the Stanford 25 video on gait. So here's the screenshot for that Stanford 25 on gaits. And so if you look this up, you will be able to watch it. It's only 9 minutes long. I think you're going to see a number of gaits that you'll recognize right off, because some of the gaits refer to people who have strokes. So you will recognize these gaits and be better able to describe them. And I think also be better able to describe this girl's abnormal gait. So I'd like to have you take a look at that gait video now on the Stanford 25. You can look it up on Google and review it together as a team together. It's 9 minutes long. I'd like to have you review the email from Dana, the physical therapist, who had some really good insights. And so I think it'd be good to review that. And then I think it'd be good to go back and look at the patient again and see if you can get a little bit more information. It sounds like the patient's definitely going to need a referral and further evaluation, but it would be nice if we can get some more complete information. One other thing I noticed was the note was not signed, and so I think you should make it a habit of signing each one of your notes, or at least putting your initials in there, so that we know which one of you has seen the patient. And so that would be useful if you can record that in the EMR when you record your consultation. And so thank you very much for listening, and I'm thinking about you and praying for you each day. I appreciate how you're serving the Lord there and actually seeing patients and doing things for them that no one else could do. And so I really think that the Lord is using you very definitely. So talk to you again. Love you much. Bye.